The purpose of this particular session is really to reflect upon the importance of strong and inclusive institutions, which are fundamental for the smooth working of any economic system and are particularly important for the delivery of key public services and public goods, which in fact are completely central to the quality of life, particularly among the poor who depend heavily on these services which are provided by the state. It is by and large agreed that there is a governance deficit in India and in Bihar. And while there has been progress in the range of public services and delivery of them, it is unsatisfactory when compared to other countries and even some other states within the country. The existing socioeconomic disparities have forced the poor to suffer to a greater degree due to the weakness of the public service delivery system. To have inclusive growth, the state needs to strengthen the inclusive public services and to design and implement effective services and policies as and when necessary. Understanding why states are less effective is the first critical step, but in finding solutions to strengthen state capabilities. Apart from these, the ongoing COVID-19 health crisis has affected lives across the world and caused massive economic and health shocks. The situation in India at this particular point in time is dire, with a second deadly wave of infection sweeping across the country. Handling this particular situation requires governance and service delivery at the highest level of effectiveness. To help policy stakeholders understand the severity of the crisis, IGC India research is focused on gathering new evidence around state capacity and how to improve them. We will focus primarily on evidence from pre-lockdown and will discuss lessons learned and the policy options for the future. As I mentioned, we have three research papers which are to be presented. The first presenter is Professor Drew Cameron. May I request the presenters to please stick to the time limit of 15 minutes because we really have to work within a very constrained time frame. So may I hand the floor over to Drew.
Thanks very much for that introduction. Yes. Let me go ahead and share my screen. Oops. Okay, so thank you very much for having me. It looks like, are you seeing my presenter view or?
Yes, we are.
Okay, let's fix that. Still seeing presenter view?
Mm-hmm.
Goodness.
Yes.
Okay, I'm very sorry. This is not very helpful.
Okay, there it is.
All right, I'm just going to go ahead and blow this up full scale, and we will go from there. All right, so thank you for having me. As Pranav mentioned, my name is Drew Cameron. I am an assistant professor of health policy at the Yale School of Public Health. And I'll be presenting today on research that was conducted in 2019. The title of my talk is Price Anchoring and for Positive Learning. And we're looking in this study at examining the effects of short-term subsidies for potable water delivery using a field experiment in rural India. Beg your pardon. Okay, well, this is a labor of love for me, and I raised this slide. This is me as a child. I raised this slide because in the context of state capacity building, even in small towns in rural Alaska, it is a pretty common occurrence to have homes that are not connected to municipal water systems, and that's a large concern throughout Bihar. And I raise this point because it's not at all unusual to have stopgap measures or stand-in municipal systems from private companies, in some cases NGOs. And in my hometown, about 50% of the population relies on water delivery through large tanks like this to storage tanks in the home. So let me give you the 30,000-foot view of this study and the big takeaways. So we were interested in this study in what happens to demand for products like water services when subsidies for those products expire. We randomized subsidy offers for water delivery services in a small village in the Supal region of Bihar. And we were interested in examining the difference or the potential effect of anchoring or learning effects. We find, 30,000-foot view again, that positive learning is what dominates this relationship. So 1 month after subsidies expire, we found that demand was twice as high among households who had received a short-term subsidy or encouragement to participate in the study. We find also that these households purchased about 140% more water than comparative control group households. We find that water is extremely sensitive to these initial discounts, and I'll go into the details here. So the main sort of economic question that we were interested in is the effect of subsidies. Subsidies are a really common tool used in low and middle income countries, as you may know, to improve the short-term adoption of critical public health goods. Examples across the board: vaccinations, vitamin A supplementation, chlorination tablets. But what we have limited evidence on is the effect of these subsidies once they expire. Are they likely to increase or decrease demand in the future? And so there are two potential mechanisms that we wanted to examine in this study. The first is anchoring effects. This is something that comes out of the behavioral economics literature. And very simply, an anchoring effect refers to when recipients receive these subsidies in the short term, they may reference that low price for that good in the future and undervalue the product on future offer. Alternatively, a short-term subsidy may provide for a larger portion of the population to engage in the activity and to learn positively that they like something about the product and value it more highly in the future. There's a couple of existing studies that have examined this so far, and they found mixed effects. How do we then think about setting up an experiment like this? Well, in time one, we would come to a household and provide a subsidized price offer. The household would choose to purchase or not purchase, and then we'd come back in the future and compare that uptake once we've offered an increased or a market price for that good. And we'd go ahead and compare that to a control group that had the same conditions, but were facing a market price throughout that entire period. So again, this leads us to the research question: what's the impact of these short-term subsidies for this particular product of critical concern in rural Bihar, daily potable water delivery, and on future demand for that product? So when we think about this in terms of sort of hypothesis testing, we have a study period in this study of about 2 months. We had an initial subsidy period that lasted for 4 weeks after a baseline survey. At midline, we came back to these households and offered, as I mentioned before, the market price for the good, and then checked to see how post-subsidy demand shook out in this post-subsidy period in the second month. And we were looking at proportion of customers on the y-axis. So our main outcomes here are demand on the extensive margin, meaning the proportion of customers in either group who chose to purchase or not purchase in any given week. And we were really concerned with week 8 as our main target week. We also looked at quantity demanded, and I'll talk a little bit about that as the presentation goes on. A null hypothesis here would be that in the first period, in the subsidy period, of course, there's a cheaper price for the goods, so demand is likely to be higher in that initial period. If there are no anchoring or learning effects, coming to the fore here, then in the second period, you would expect demand for the product to be similar between these two groups. Alternatively, if we expected some sort of a positive learning effect to take place, then you could anticipate that in that second period, demand would be higher in the treatment group. And then, of course, what we're really concerned about in the literature is what about this anchoring? And in this case, you might expect to see demand for that good go down relative to the control group in the second period. So that's what we're testing for. We've got a couple of secondary hypotheses. We're interested in the pre-shock period and how learning effects might play out during that period. Of course, positive learning during the pre-shock period, you would expect demand to either be level or to potentially increase, a little ambitious. If there was negative learning taking place during this period, or in other words, if folks were deciding that there was something about the properties of the good that they didn't like, then you might expect to see demand decrease. And then our sort of secondary research question really examines demand right at this price shock between weeks 4 and 5. And so if we expect no anchoring to be at play, then we don't expect to see any change in demand right around the price shock. Whereas if we expect anchoring, then we would expect that demand to go down. So this is sort of differentiating potential price effects from, anchoring effects from learning effects. So the setting doesn't need any particular introduction. Folks are very familiar. Rural Bihar has a problem with consumption of clean water. So roughly 94% of households throughout the state use shallow government-built hand pumps for their drinking, cooking, and cleaning. This is a step up from an untreated surface water source. That said, this source of water is still subject to a tremendous amount of biological and chemical contamination, particularly during the rainy season, when monsoon floods will, potentially inundate that shallow water table from the point of the pump. Our sample in particular, as you may expect, WASH education was extremely poor. Only 2% of our sample report ever treating their drinking or cooking water. The monthly median income in our sample, just for a point of reference, is around 9,000 rupees, or about $4 a day. And our households, the study households, roughly 43% had no formal education among the heads of the household. And again, very low willingness to pay for clean water. So this is just a quick shot of a day of rain during the monsoon season, about a mile from the study site. So it gives you a good, strong sense, as many of you are familiar with the potential for back contamination. So the trial itself, we had some selection criteria. We selected households who, had a common cook stove, were not current customers of our NGO. And then we went through this procedure in which we conducted the baseline, and we had a social marketing exercise. And so I'll go over that really quickly. The social marketing exercise was conducted by young men aged 18 to 25. They used a very loose marketing script to describe why water was important to them. And this was really a strong recruiting message that we were trying to send. We also provided a taste test and a visual demonstration of the properties of the untreated versus the treated water. And you can see from the picture of the two cups there, from that visual demonstration, we crushed up guava leaves, dropped them in water that came from the NGO, Shri, which I'd like to say more about during Q&A potentially, and in a cup of the untreated water. And the tannins in the guava leaves react with the iron content in the water, in the untreated water, and they turn that water jet black within about 2 minutes. So you can see it happen right in front of you. So this is sort of a powerful signal to families. Maybe I should consider either treating or purchasing my water. Sale offers were intent to treat. And the NGO has been operating in the community for roughly 5 years, about 7 years now. They run a series of sanitation facilities, trying to get folks to discontinue open defecation. And as a part of that business model, they've incorporated the sale of treated water to the local community in 3-wheel trucks. So the trucks go around and fill up folks' 20-liter water bottles that they have in their homes. The trial itself, we made it clear to folks during the trial that participation with these discounts was non-transferable. There was no cash value. The offer expired after 30 days or 30 bottles, whichever came first. And folks could choose to pay as they went or pay for the full month upfront. They needed a bottle and dispenser to participate. I won't belabor that point, but we offered a trial period, and that's another key consideration when trying to induce participation in these types of schemes. We provided 50% off of the bottle and dispenser initially, and provided families with a 2-week period to pay that off. So households were randomized into either a 10 rupee price or a 5 rupee price for water deliveries. 5 rupees was the sort of 50% discount, and 10 rupees was, a rough approximation of the market price, which often fluctuates. So major results, I won't belabor this. We had 273 households in treatment and 241 in control. That sample was relatively well balanced, which I won't go into, but here are our big takeaway results. So in week 1, there was about a 22 percentage point difference in uptake between the two groups, and that stayed pretty constant through that initial bottle period that I mentioned. By week 4, the difference between these two groups, again, treatment group on the top, control group on the bottom, and this is proportion of purchase per week, about 11 percentage points difference. So things started to level off right before the price shock. And so we were very interested in what's going to happen in this second period. Well, it turns out that demand stabilized during that second month. So a reminder that during those last 4 weeks, households were all facing the same price for the good. By week 8, there was a 13.1 percentage point greater demand in the treatment group than in the control group, and the control group purchased around 140% less water than the treatment group. So back to our sub questions, we were interested in that initial learning period, that subsidy period. And as you might expect, there was a little bit of what I will call negative learning. This might also have been related to the price effect of the bottle and dispensers. So some folks decided they didn't like the bottle and dispenser particularly much and backed out of the trial in that initial period, especially in the treatment group. The second secondary research question we're interested in is that demand right around the price shock. And we don't find any evidence of anchoring on the extensive margin in terms of the proportion of folks purchasing water. We do find a slight decrease in the quantity demanded among the treatment group, which shakes out to roughly an arc price elasticity of -1, meaning that as the price goes up, there's a corresponding drop in the quantity desired, which again isn't necessarily evidence of anchoring. So some big takeaways here on the learning experience. We found positive learning among our sample in a survey at Endline, that folks really liked the treatment delivery convenience. They appreciated the taste, the price, and the safety, and substantially more than non-customers. And likewise, there was a finding that folks were not particularly happy about the temperature of the water. It was hard to keep it chilled. It was the middle of summer, so this was July and August. And cold water is a major concern. So even given a safe water source that's warm, folks will, in many cases, turn their noses up at it if it's not cold, because it's extremely hot outside and people need to be cooled down. We also find in a revealed preferences experiment in our pilot, which I won't go into, that taste and temperature were sort of the two factors that changed the most substantially between a baseline period and a period of sampling the product. So those are major considerations when you're trying to market a product like water. Taste and temperature have the most room for growth. Main discussion here. So again, I won't belabor the conclusions. We have a pretty substantial finding in terms of the effect on demand, evidence of large learning effects. Our main policy recommendations here, though, demand for this product really does exist in regard to what people view as what should be a municipal water system. So folks who are likely to purchase would do so if the product is clean, is safe, is simple to use, and importantly is reliable. So those are major considerations from conversations that we've had with respondents. They also view this largely as the government's responsibility. And so it's not entirely surprising that less than 50% overall of our sample wanted to participate in this delivery scheme that was managed by a non-governmental organization. Water delivery, again, in this context, this mechanism is really a stopgap. we're trying to supplant a municipal system that doesn't exist. We don't want to support, inefficient uses of people's time or inefficiencies in how many people and how often people are consuming daily water, because violating sort of using clean water even once or twice puts a family at risk. And so this really is, again, a stopgap on the road to a municipal system. Finally, there's a little bit of a concern. Discounts and trial periods for these hardware investments really are critical if you want to recruit people. A lot of folks are really hesitant to make that initial investment. And so help on that front would be absolutely critical if you want to capture the largest sample. I won't go into major limitations. We have some generalizability concerns. Again, we'd like to continue this study in different contexts and see if there's sustainability effects that we can try to capture. And there's some concerns around possible inaction inertia effects, but I won't get into that now. So special thanks again to Shri, the NGO partner, Sanitation and Health Rights in India. They operate out of Supal, and you can look them up on the internet. Thanks to Jivika, IGC, our study coordinator, DCOR, and this research was conducted during my time at the University of California, Berkeley. So happy to take any questions at the end, and I'll turn the mic over.
Thank you, Drew. That was certainly within time and very succinctly done. Thank you so much for that. May I now turn to the second presenter, which is Professor Emily Paktigian. Emily, would you come on, please? And again, as in the case of Drew, 15 minutes.
Great, absolutely. Are you able to see my screen?
Yes, yes.
Wonderful.
Very much.
Okay, well, thank you all for being here and for inviting me to talk about my work with IGC. My name is Emily Paktigian. I'm an assistant professor at the School of Public Policy at Penn State University. And today I'm going to be talking about work that I've done with IGC on collective action for sanitation, in which we'll discuss experimental games that we ran in rural Bihar and Orissa. I wanted to begin with a brief motivation on sanitation in India and its role as a policy priority from both the national and state governments. I won't belabor this point, as many of you are well aware of the sanitation context in rural India, but there have been a series of nationally enacted and locally implemented policies starting in the mid-1980s and culminating with the most recent Swachh Bharat mission that have aimed to increase access to safely managed and improved sanitation. And if we look at rates of open defecation in rural and urban India, we see two very stark realities. The first is that while there are some instances of open defecation in urban areas, sanitation is, as the national policies have identified, a rural challenge. And so focusing on rural sanitation is an appropriate policy space. The second and encouraging thing to see in these trends over time is a reduction in open defecation at the state level that continues even post this 2006 or 2016 time period that I show in this figure. And so there's a lot of lessons that we can learn from investigating open defecation and sanitation behaviors in some of these rural areas to better design policy to both encourage latrine use, but also to think about the sustainability of policy design. The academic literature has also investigated sanitation in rural India, and I wanted to present kind of three stylized motivating facts from the literature. The first thing to note is that resource constraints, in addition to social norms and traditional behaviors, impact latrine adoption and use trajectories. And so it's important to consider not only the hardware and financial side, but also the demand side of sanitation access. The second piece from the literature to identify is that poor sanitation often leads to health consequences, yet improved sanitation does not necessarily generate all of the health benefits that a household might expect. And this is because households share a public health environment, and so they're affected not only by their private sanitation choices, but by the choices of those around them. And this gets to the kind of crux of the research that we do in this project. And then finally, we note that while health dimensions are certainly important to consider in the sanitation space, non-health benefits such as privacy, dignity, convenience, and status are certainly important motivating factors, and non-health consequences exist as well. And so we shouldn't think about sanitation only within the health dimensions. We should think about it as a complete package. So this gets me to the questions that motivated our research design. First, we wanted to understand whether individuals were more willing to contribute to public goods when their collective action would benefit their social peers. We do this within the sanitation context, and we really ask, are people more willing to invest in improved sanitation if they know that the beneficiaries of their private sanitation choices are their friends and neighbors? And that point has been made salient to them. Second, we ask if preferences for sanitation practices expressed during experimental games relate to actual household sanitation behaviors. This is more of a methodological point, but we want to understand the preferences that we're eliciting during the actual field component and how they map to reality. And third, we want to understand whether kind of light touch interventions such as experimental games can provide messages to households that might have some sustainable impact on their sanitation and hygiene choices. We run this experiment or these experimental games in two regions of India, in the Bhadrak district of Orissa and in the Vaishali district of Bihar. Our fieldwork had two main components. First, we ran a series of these household surveys in October of 2019. At the same time as this initial household survey, we ran experimental games in all of our villages in Bihar and Orissa, and we invited households that participated in the surveys to send a participant to participate in the experimental games. And so we have substantial overlap between the sample of households included in the surveys and those included in the games, which allows us to map gameplay to actual sanitation practices. The sample that I'm going to be presenting results on today is that sample for which we have the overlap between the surveys and the games, which is approximately 1,500 households. We also returned to all of our households in Bihar, all 900 households in Bihar, in December of 2020 to do follow-up data collection on household sanitation practices to measure the extent of how this experimental game influenced sanitation and hygiene behaviors. I will, of course, note that the first wave of the COVID pandemic had occurred in that intermediate time. And so we did also investigate some of the impacts of COVID on household sanitation. So just to give you a bit of insight into the experimental games that we ran in both Vaishali, Bihar and Bhadrak, Orissa, we played games in groups of 5 to 7 participants, as you can see in this figure here. And we used a sample of participants that were invited from those household survey respondents. At the village level, we randomized the composition of groups in which we played these games into within gender and mixed gender groups. So in some villages, games were played entirely among male or all female groups. And in other villages, we played these games in groups of mixed gender. And while gender is not a perfect measure of social connectivity, in our context, respondents and participants were certainly more comfortable and familiar making financial decisions and talking about health and sanitation within gender groups. And so this does provide some measure of social cohesion to examine the variation of in our results. We played a version of a public goods game in the field with a particular sanitation context. So I'll describe those two pieces in turn. First, we played a public goods game, which essentially means that individuals were contributing to a public good during the game play, and that their payoff depended not only on their own contributions, but also on the contributions of their entire group. And so essentially, During each round of gameplay, our respondents or our participants could receive an actual cash payoff that had three parts. First, all of our respondents were given a 35 rupee budget for each round of gameplay, and they were allowed to keep any portion of that 35 rupee budget that they did not contribute to this public good context. In addition, there was a public benefit of their contribution that could be accessed if, as a group, they contributed above a certain level of threshold. If the group's aggregate contributions reached above that threshold, the total contribution was multiplied by a factor greater than 1 and then evenly distributed to all participants regardless of their individual contributions. That's the main piece of a public goods game, right? That there's an incentive for households or for participants to underinvest because then they can keep more of their original budget, but there's also a kind of public incentive to invest to try to reach that threshold. We also did incorporate a small private benefit of the contribution in an effort to more closely mirror the sanitation context in which there are both private benefits and public benefits. So to give you an idea of the gameplay and how we built in this sanitation context, we began our experimental games with group introductions and enumerator instructions. We then played some practice rounds where participants could practice contributing and making decisions within their groups. We then held a short instructional training facilitated by our field team, in which we focused on the collective and public health nature of household sanitation choices. The message that we tried to present was that household sanitation preferences and behaviors impact the overall public health environment and influence, therefore, the health outcomes of friends and neighbors. We also focused on this training on clarifying to respondents that they were also impacted by the sanitation practices of their local communities. After this instructional training, we played 3 payoff rounds in which households actually received the payoffs from their game decisions. And in these rounds, they were asked to make contributions according to the kind of sanitation or hygiene practice that was associated with their contribution amount. And so these ranged from small sanitation investments in hand washing and soap to substantially larger investments, here the entire budget that they were allocated, which was supposed to correspond with household latrine building and use. After each round, households learned participants learned whether or not their group had unlocked the public portion of the payoff. They learned what their payoff would be, and then we proceeded to the subsequent round. We then had a debriefing survey in which to understand a bit more about how households and participants made decisions during this game. So as I mentioned in the motivation of this work, we had 3 main kind of research objectives. And so we have 3 empirical analyses that we run to provide some insight into these questions. Our first question was to provide insight into how group composition influences household sanitation preferences and actions. And so for this, we analyze the actual contributions that participants are making on the basis of that randomized variation of group composition. So in this specification, essentially what we're looking at is whether or not there's an impact of group composition or being randomly assigned to a within gender group composition on the level of bids and contributions that households are making in that experimental game. To provide insights into how closely the preferences elicited during the experimental game match to actual household sanitation behaviors, we then look at the relationship between a household's bid during the game or their contribution during the game and an actual household sanitation practice as measured by the household survey. And here the practice that we look at most carefully whether or not household members are regularly using public or private latrines, which map to those higher levels of contributions in the experimental games. And then finally, as I mentioned, we do develop a panel for our Bihar sample in which we have data from both 2019 and 2020. And so we do a difference in difference analysis in which to examine whether or not hand washing frequency, latrine use among children, or overall household latrine use changes based on differential experiences with those experimental games, notably whether they remember playing the experimental games in 2019, whether or not they made high bids themselves during the experimental games, and whether or not their game actually reached that public threshold to unlock that public version of the contribution. So just to provide some results from our analysis, first at the overall game level, we see the following trends. We see that in early rounds of gameplay, our groups that were played within gender, so entirely male or entirely female groups, were more likely to unlock that public contribution compared to our mixed gender groups. If we disaggregate this among male and female participants, we see that difference is largely driven by actions among our entirely female groups. And so essentially we see much higher contributions and a higher likelihood of unlocking that public contribution and public payoff among our entirely female groups compared to our entirely male groups or our mixed gender groups. These trends also bear out in the empirical analysis at the individual level, in which we see that in early rounds of gameplay, those within gender groups are exhibiting a greater likelihood of reaching and unlocking that public contribution, but that this is generally driven by our female participants in the first round. To get to our second question about the relationship between sanitation practices and preferences elicited during the game, our descriptive statistics show, a slight positive correlation that households that are actually using latrines and owning latrines are more likely to make these higher contributions. And when we investigate this among male and female participants, we see that actual household sanitation practices more closely mirror the game contributions among our male compared to our female respondents. And then finally, when we look at changed behavior in the 2020 wave, we see that among households that are remembering the game, there's a small increase in hand washing frequency. And among games that were played where the public payoff was reached in that third round, we see a small increase in latrine use among children, suggesting that these light touch interventions that are focused on these social and public collective action components of latrine use are important in terms of thinking about household sanitation behaviors. So to conclude with just some main takeaways, first, we find that our participants are more likely to contribute to collective action among similar peers, as evidenced by these differences between mixed gender and gender homogeneous groups. These changes are kind of driven by the differences in sanitation preferences among women and men, where we see these higher initial contributions among women, suggesting that having diverse preferences and diverse representation on decision-making bodies in the sanitation space is particularly important for sustainable policy design. We also find that trust is important when seeking collective goals, and that over the course of gameplay rounds, contributions became increasingly similar, suggesting that there can be trust-building mechanisms built into policy. And finally, we note that some of these light touch interventions could inform later hygiene behavior, although it's important to think even more broadly about the long-term sustainability of such interventions. So I'll end there. Thank you very much for your attention. I'm looking forward to continued conversation on this topic and state building capacity in general.
Thank you so much, Emily. Can we go to our last presentation by Uma Sarmishta? Uma, again, you have 15 minutes, and the floor is over to you. Uma, are you there?
Hello, can you all hear me?
Yes, we can hear you now, Uma.
Okay. Okay. Thank you so much. And good evening, everybody. Thank you, IGC, for giving me the opportunity to talk in such a good panel. So I will be talking about my IGC project on solid waste management, a case study from Bihar, and I will take into another perspective of public service deliveries. It's the solid waste management from the citizen perspective approach. So in this presentation, I will be talking about introduction and then followed by data and methodology, some results and conclusion, followed by policy recommendation. So giving us short background, according to a recent World Bank report, the world generates around 2 billion tons of municipal solid waste annually. And with a very conservative estimate, around 33% of waste is not treated in an environmentally safe manner. When it comes to India, Indian cities generate approximately 62 million tons of solid waste management, and approximately 80% of those goes untreated in landfill. The daunting problem is amplified when it comes to a city like Patna, which is unplanned, growing exponentially. And according to a recent study by Pandey, the daily waste generation of Patna is around 1,200 metric tons, which include organic and inorganic waste. Let me give you a background of what is organic waste and what is inorganic waste. Waste is segregated into organic, inorganic, hazardous waste. Inorganic waste is mostly cardboards, the bottles and all the cans. Hazardous waste is mostly medical and sanitary waste. These two are very difficult to manage at home, and like individually people cannot do anything about that. So we'll not talk about that. We'll talk about the global waste composition. In the global waste composition, the 44%, which is food and grains, which is, according to recent studies, it's very easily and can be easily and accessibly managed at home or at the community level. So we will tap into that aspect. And in India, nearly 70% of the municipal waste and around 90% of the household waste can easily be recyclable at the household level or the community level. And it's not like different Indian cities are not doing. Pune, Bangalore, these places are working with citizens to do a bottom-up approach where they are getting citizens into citizen participation in the process of waste management. And this is what I will be talking about, how it can be added to Patna. And Patna has the advantage, and I will be talking about that, like what Patna has the advantage of going to the bottom-up approach. So with that, my research aim for this study is to explore the possibility of locating the citizens who are the waste generator as the focal actor of the waste management system, with the agency to recycle their own waste and seek the support of the other, that is the states and NGOs, as and when required. We investigate the problem in three-dimensional approach: current practices, level of awareness, and willingness to contribute and bring changes. It could be monetary and non-monetary aspect. Overall, the study will aim to include citizens in the process of the decision-making and how that can help in policy implementation. So for the study, we did a mixed method research. The data is derived from a mixed method research in Patna. Patna, as we all know, is one of the dirtiest capital of India. It has PMC is the sole responsible for waste collection, even though PMC was formed some 150 years back, and still waste management was included very in last 5-6 years. So it's a very new concept, and people are happy about that. We did a simple random sampling in 5 wards, 5 selected wards in Patna: Patna Sahib, Khurji, Kankarabagh, Kadam Kuan, and Gaighat. So there were 540 households for the survey. Survey was conducted between December 29 and February 2020, just before COVID hit. The survey was supplemented by 25 in-depth interviews, 20 focus group discussions, and several case studies of household doing their recycling at home. So let's start with the current practices. What is people doing? How people are disposing their different kind of waste? So going to the first graph, we can see that organic waste, which is fruits, vegetable waste, around 86% of the respondents said they throw it in the trash can or in the garbage. Followed by medical waste, which is 87%, sanitary waste, 98%. These sanitary waste and medical waste, I don't want to focus that right now because it's very difficult to do any kind of thing at home. It's the government have to step in for that. But Patna as such, my respondent actually, I have done very good when it comes to newspapers, old clothes, old utensils. So Kabadi Wala, and that is an incentive-based approach again. So it is, Kabadi Wala is taking care of newspapers and old utensils, followed by donations and giveaways of older clothes. So this gives a very good picture of where we are standing, except the organic waste. Secondly, we asked about how they are disposing, what are different mechanisms, and around 53% said they wait for garbage truck. And that is a very new thing in Patna, thanks to the PMC game changer under Swachh Bharat Abhiyan. They had a door-to-door waste collection. According to our interview with Additional Municipal Corporation, a total of 375 waste collection vehicles deployed across the city from 6 a.m. to 2 p.m. every day. And they collect they collect waste from each and every streets of Patna, and that has made Patna prettier, and much of the garbage is out of the streets, as far as I saw 2 years back. And the funding for this came from Swachh Bharat Mission, Swachhta Abhiyan, and a user fee of $30 per house, which in our sample majority of people were paying. Second comes the journey of waste. So what happened to the waste when it starts? So it starts from the household level. Some people do segregate it in organic and inorganic bits. Some people don't. Then it goes to the secondary dumping point. The major dumping point right now in Patna is Bakri Bazaar, and which is just in between the city. And then from there, in an open truck, mostly in the open truck, it goes to Ramchak Beria. Ramchak Beria is actually the new landfill of Patna, which is around 14 kilometers from Patna. And according to PMC, 770 metric ton of garbage is collected and disposed at Ramchak Beria. The new landfill is creating job there. There are a lot of kabadiwalas and the rack pickers who are getting job there. There are a lot of industries coming up to recycle some medical waste. But at the same time, it is coming with a health hazard to the village. A lot of people were complaining, and we did a small case study there. I have written a separate blog on that for IGC, and people like this house is a part of that village, and the person was commenting that the family was commenting that before the garbage used to go till the landfill, and now it's coming near and near to their home. So it is bringing a lot of health hazard to the village. Secondly, we talked about level of awareness, level of like what they know about the waste management system, how the landfill look like, what is organic waste and recycled waste. So only 24% of the household were aware of the PMC solid waste management practice in Patna. About 40% responded that they knew that it goes to the landfill, and 16% said they were aware that it is going and dumped somewhere around the city. Only 0.5% of the household knew location of the landfill, and 40% said they have heard about it. Despite the lack of awareness, more than 90% of the family expressed their satisfaction with the current system of waste management. As I said, it just started 3 years back, and people are happy that at least their streets are getting cleaner now with the Swachh Bharat Abhiyan. So people express in the qualitative also, people expressed how recently it has changed a lot and city is looking much more cleaner. Then we talked about the perception of harmful waste, and according to around 90% people, plastic bags are the most harmful waste in and around, and that people actually in the qualitative asked for banning the plastic ban. The recent flood was one of the sentiment attached to why plastic is bad, because according to them, the sewer systems were blocked because of the plastic bags, and that created a havoc in the last flood in Patna in 2019, I suppose. Awareness about compost and organic waste management. Around 60% of respondents have a knowledge about organic waste. Knowledge about organic waste is positively related to the higher income and education. What you can do with organic waste, around 81% said that it can be composed, and that's what we needed. That's what we have to make sure that people understand, that organic waste can be composted, and how they can compose. That's also we asked. We actually showed them some pictures of what are different ways at household level they can do the composting. And in the qualitative survey, actually people came out and start talking about how they are doing different ways, and how at their villages they used to do different kind of waste, so that ways to recycle the organic waste. And that is, as I said, that is very much related to Patna's rural roots. Patna, majority of people in Patna have a rural roots, and that created a good backing, good advantage for Patna to start recycling at the household level. So around 65% respondents stated that they are aware of recycling organic waste at home. Then the final thing we wanted to ask is willingness to contribute, and what they can do to bring changes in monetary and non-monetary way. So first we started with, in non-monetary way, what are your contribution, how you can possibly help. So willingness to contribute at individual level, 50% of respondents were willing to find a solution and work with the government to have a better society, or better living place. However, the proportion of willingness to contribute at individual level declined with higher income and higher education, and that was very puzzling for us. Like more than 50% of respondents with less than 50,000 income were ready to contribute, while only 42% with greater than 8 lakh household income are willing to contribute. How they can contribute when they said we can consume less plastic, we can do composting at home, we can dispose the waste properly. So people are ready, because they have seen, Patna as such has seen how dirty it was, and how and everybody is ready to step up. So then our next question to solve the puzzle was lack of the reason for lack of willingness to contribute, and this reason. So many people said, around 66% in the quantitative survey said can't do anything and unaware of how to do it, and around 9% said it's government job. So they are very much interested, but at the same time it says it's not our job. From the qualitative survey, when we talk, especially in Kankarbaag area, it was lack of time, lack of space, waste management by household help. And that is again a very big problem in the middle class family, that both the breadwinners are going out for work, and they don't have time to do the waste management at home, and it's always taken care by the house help. And then finally, the NIMBY approach, which is not in my backyard. Then the second, we try talking about the community level, which is willingness to contribute at a monetary level if community come up with something. And we got a very different result here. But before we went ahead of that, we actually explained some of the success stories in Patna. Like this picture is from Magad Mahila, and Sunai Consultancy is working with Magad Mahila and Patna University to create a compost unit for that organization, and it is working very nicely. So we talked about that. We talked to the ward councillors, and one of the ward councillor actually was willing to get a compost unit if 50% of the population in his ward is ready to contribute. So let's see what was the effect, what was the results there. So willingness to pay, around 50% again of the respondents are willing to pay for the community level organic waste recycling. The amount of pay varied. It was very varied. It started from like 3 rupees to 5,000 rupees. But on an average, 24% are willing to pay around 100 rupees, while 14% are willing to pay around 500 rupees. For monthly fixed maintenance costs, because we talked to Sunai Consultancy about how it operates, and they said we need some maintenance cost also. So we did ask that question to the respondent, and 40% are willing to pay on an average of 75 rupees per month. Reason for lack of payment, again, 31% said, around 32% said they are not interested. 21% said it's a government job and we cannot we don't have to do. If we are paying 30 rupees, why should we have to pay some other amount there? Then 20% said cannot afford to pay. Finally, to find a factor influencing willingness to pay, we ran a Probit model to empirically estimate the relative importance of the key factor, which determine the willingness to pay for the improved organic waste management services. And the results came out pretty good. Family size and income are positively linked to willingness to pay. Owned house versus rented house, positively related to willingness to pay. Awareness about the existing solid waste management is positively related to linked to willingness to pay. One puzzling thing which came out in the study was women respondents are less likely to pay than male respondent. I think because we are thinking that is because they are not the household head, but they are just the respondent, and decision making when it comes to monetary, it always goes to the house head. Then FGDs also showed that in the interview showed that the awareness regarding solid waste management play a vital role in influencing people's willingness to pay. So overall, what we think is it's very important, and solid waste management is a major challenge, and especially for city like Patna, which is growing right now, and we have to manage solid waste management at this level rather than when it gets more hazardous. Managing solid waste management by municipality is unsustainable, and Patna has the advantage in creating bottom-up approach toward waste management, because it has rural linkages and citizens have ample of knowledge of waste management, especially organic waste management and recycling at home. So preliminary findings suggest that there is a disconnect between understanding the role and responsibility of policymakers and citizens on the waste management process. Stakeholders complaints about each other, like people are complaining about government is saying the citizens don't have civic sense and they are creating more havoc. So it's just the disconnect, but the silver line is the door-to-door garbage collection by PMC, and the majority are waiting for are utilizing that service, and 50% are willing to contribute for the change. So it's a very good thing, and if PMC and other departments come together and work together in this aspect, it can lead to changes. So finally, some policy recommendation. A long-lasting sustainability can be achieved through awareness program at the individual, household, and ward level at the current system. Tailored program of solid waste management should be advertised and implemented. We can have women-centric programs. We can have children-centric programs. Children should be, like I remember when I was a kid, Kabadiwala was one of the things which we used to do as a kid, because we knew we used to get money out of that if we give a newspaper to the Kabadiwala. So children of the household were very happy to collect all the newspaper and wait for Kabadiwala on the weekend. Area-specific program like Gai Ghat, and wherever the river bank is there, we can have different program, while interior cities like Kangarbaag can have another program. Civic body engagement will be very helpful. Use of NGOs, like we talked to 3 NGOs, Sunai Consultancy was one of who was very, very ready to contribute and come and be a part of government work to make the city cleaner. Local organizations are also very helpful, private bodies. Then incentive-based approach like tax credit, free distribution of segregating bins, free cleaning supplies. All these things are going on in different parts of the world, and Patna can introduce that in their city too. The elected ward officers can play a vital role in the engagement and awareness drive. And we did talk to all the ward officers in the 5 wards, and some of them are very, very excited and want to help to make their ward beautiful. So, and that is very important, and that can help as a demonstration effect. So PMC could choose one ward from the 6 circle and initiate the awareness campaign, convert this into a model ward, and then it can go ahead with creating more wards which can be helpful in solid waste management. And at the same time, this model ward, if they are doing some kind of successful models, the people can see the change, and the PMC will save money on that, because they will have to take less garbage now out of the city to the landfill. So landfill is the reality of every city, and we cannot get rid of landfill. What we can do is we can reduce the burden and make environment a better place. And with that, I think I'm ready for question. And thank you so much again.
Thank you, Sharmishta. Now, unfortunately, we have two policymakers with us for the discussions on the presentations. The first is Mr. Arvind Kumar Chaudhary, who heads the Rural Development Department of Government of Bihar. So may I invite Mr. Chaudhary to please offer his comments?
Now, am I audible?
Mr. Chaudhary, you're a little faint. Maybe you should come closer to the mic. No, still faint.
Okay. Is it better now?
Oh, terrific. Much better. Thank you.
Okay. First, I must thank IGC for giving me this opportunity and inviting me. This is a topic which is very close to my heart. Definitely, the state capacity is very, very important. The presentations today were also very good, though, as the presenters have also pointed out, say, for example, when Drew Cameron presented his points, whether the findings that are there are have had sufficient time to do the experimentation or not, the findings that are coming out, whether they will sustain or not. But definitely it did come out that the short-term incentive model probably may not work. So that was my understanding of, because the kind of result that we expected are probably not there. Coming to the second presenter, health outcomes. Emily, about the sanitation aspect. That I found quite interesting, and these sorts of experimentations give us the way how we can design some incentive mechanism which will be more useful. But in both those matters, let me give you the present scenario as well. While the data that Drew showed that the drinking water availability was very poor, let me tell you that Bihar government has launched a campaign, Har Ghar Nal Ka Jal, that is tap water in every household. And the coverage today is on the higher side of 80%. So more than 80% households the water, drinking water is being supplied through the tap water now. And if you look at the design that is there with that program, there is a design that the water comes from the groundwater source, which is nearly 300 feet deep. So water is sufficiently good quality. It covers around 150, 160 households, one such unit. There is a local body created at the ward level which looks after the scheme, which runs the scheme. It also collects the user charges from the households and maintains the facilities. I think this is the only way it can actually sustain. There is a provision also that the water that is being supplied, every 3 months there is a tasting of quality of that water. I think with all those measures in place, definitely things, if you go today, would be far different from when the experiment was done. Or I don't know whether now the offtake for bottled water will be to what extent. Though in due course, as we develop, even we have seen earlier we used to drink water directly from the tap, but now most of us are shifting to bottled water when we go out of our houses. Second, when what Emily showed, the kind of sanitation, I think sanitation coverage also overall India has made huge progress. As she has also mentioned, Bihar also has made quite significant progress, and definitely at least 80% plus, definitely the problem of open defecation has been solved. Now the next stage problem remains is that of waste management, solid liquid both. So that's a very important thing. And another aspect which she very rightly covered, whether this change of behavior will continue, whether they will continue to use the latrines that have been built. Second, whether they will or they are using hand wash after using the toilets. The models that we have tried, definitely the woman-based groups are the most potent, and because they have much more feeling for the health of their household, particularly the kids and everyone. And second, focusing on the schools, focusing on the child. Once we change them, we have definitely changed the next generation. These sort of changes are very, very difficult to bring about. And to tell you honestly, I had not thought that I'll be able to see that kind of change in my lifetime, but I have seen, and I have been lucky to be spearheading that initiative in Bihar. The findings definitely are very good. And Uma, I would like to compliment, you have taken a very difficult topic, and I'm really very happy to hear the comments that you have made, that the changes in the waste collection scenario in Patna has improved a lot. And I do hope, I too have had many discussions with a different forum, even with the present municipal commissioner, as well as the principal secretary of the urban development department. And I do hope that just like cities like Indore and all, Bihar and Patna particularly will also show the lead. And not only Patna, slowly this will percolate to other cities of Bihar as well. And I'm very encouraged to find that people are willing to pay. That's a very, very good finding, that people are willing to pay. And once they start seeing the kind of the changes that are there. Now let me come to the topic for the day about the state capacity and its impact on development outcomes, if I say it broadly. I can tell you from my experience that many of the programs are designed as demand-driven programs, but even they are constrained by the supply side constraints. Now, supply side constraints mean what is the capacity of the mechanism that is there, the government machinery that is there, their capacity to deliver the results, deliver the program on the ground. There have been significant changes. I saw some of the pointers that have been provided to us about the questions, but let me tell you, there have been very significant changes. One, I find that a question about the money reaching to the beneficiaries through various channels and all, those days are now totally over. Most of the rural development programs are, there is DBT, direct benefit transfer to the beneficiary in their account, and there is no intermediary in between. Second, now they have also to a great extent understood that it comes to their bank accounts directly and they don't need to go to any intermediary. So there have been changes. But more importantly, let me talk to you about my personal experience about the state capacity. Once we have enhanced the capacity of the state, the results that are there are really quite remarkable. I'll tell you from my experience of Manrega in Bihar. I've been in this department for more than 5 years now. So I have seen the journey from 35 million man days to now, I think 228 million man days. So that has been the kind of jump that has been there in Manrega program from 3.5 crore to 22.85 crore last year. These many mandates, if that many mandates are being created, the benefit that's reaching out to the people is definitely far more. And how could this be possible? This could be possible because we focused on the delivery team. Many of you or some of you might have read a book by Vineet Nair of HCL Infosystem, which is called Employees First, Customer Second. So what he says that once you want to deliver some good result to your customers, you have to focus on your employees, because who are in close to touch to the customers? It's your employees, and you yourself are not there. So if your employees are taken good care of, they are properly trained, they are capacitated, and they are enabled to take decisions and also enabled to do necessary, have the necessary wherewithal with them, they deliver, they show the result. In case of Manrega in Bihar, I can tell you that we strengthened the machinery. We also worked on the demand side. There also, I'll talk about the state capacity. We worked on social audit society. It's a separate society. It hires people from ground, from among the beneficiaries, mostly women, who go as social auditors, look at the programs, and then have a Jan Sunwai at the panchayat level, gram village level, and talk about the outcomes that are there and how they should be and what are the issues. What we have found that if we just continue to do the social audit in one village, maybe once a year, the quality of program improves tremendously. So this again, though being delivered through the support of the people at large, but again relates to the capacity of the state. So definitely once we increase the capacity of the state, the outcomes are far superior. Another example I would like to talk, and I would like to thank the first presenter who said that Drew Cameron, that he also thanked Jivika. So Jivika is a program under a very ambitious program of Government of Bihar and the Rural Development Department. Now it is a huge network of self-help groups. More than 1 million self-help groups are there. More than 10 million households are part of this. And the outreach is remarkable. But how could this be possible? It could be possible also because we had a very good political support, government mandate, but at the same time, we created Bihar Rural Livelihoods Promotion Society, also popularly called Jivika, as a very professional body. We did not create it like an NGO or something like that. It has very well-trained professionals and who are not only given due training, but who are also capacitated. It has very good systems in place. We take good care of our staff, and in turn, they are able to take care of the clientele that they serve. Reaching out to more than 10 million households is not an easy task, but that is happening. So these 2-3 things I wanted to just share from my personal experience. And when we talk about capacity and resources, in my personal experience, there is just one important resource, and that is human resource. Once good human resource is there, they are able to mobilize all other resources. If good human resource is not there, any other resource is actually immaterial, doesn't help much. Thank you. I would like to close here right now. If there are any more questions, I'll take later.
Thank you. Thank you very much, Mr. Chaudhary. Unfortunately, Mr. Balamurugan has not yet been able to join. He's having connectivity problems of some kind, apparently. So in his absence, I would take the liberty to ask the paper presenters a few questions, if I may. Let me begin with Drew. Drew, the thing is, when you talk about the anchoring and learning effects, I would presume that whereas the anchoring effects would actually kick in fairly quickly, the learning effects, on the other hand, would depend upon perceptions about positive outcomes of whatever intervention is being made. Right? Now, you're talking over an 8-week period. Now, I'm not sure medically whether over an 8-week period there would be a perceptible difference in the health metrics of the target population. Now, if that isn't there, you really shouldn't expect too much learning effects to be around. I mean, after all, you are doing a trade-off of some variety. How do you handle that?
Sorry, go ahead.
In a sense, yeah, let me just say, then we'll come back to each of you, because I think Mr. Chaudhary has raised some rather important points as well. The question out here is that, as far as the sanitation and the toilet, all of that is concerned, again, it's a similar problem. That is, the outcome effects will be felt with a significant lag, right? So till those effects are perceived, and if the lag is too long, one of the things that can happen is people can actually forget the kind of situation they were in, 2 years ago, and therefore the comparison may not work. It's a gradual process, a very evolutionary process, so that doesn't work terribly well. So there is a bit of a leap of faith that's, again, getting involved in all of this. How do you handle it? And Uma, I mean, yours is actually the trickiest, because in your particular case, you've taken the principal problem away from one particular location and dumped it on another, right? What I would have really liked to have heard is what happened and what are the reactions of people in the village where the landfill has happened. So we've got a situation where people in Patna are willing to pay. And that's very good. And I think Mr. Chaudhary can actually work on this. The question is that the recipients of the negative externality would they be willing to accept compensation? Or is it being done simply through the coercive power of the state? I suspect it's the latter. And if it is the latter, then in a sense, you're not solving the problem. You're just moving it out of one location to another, possibly with even more harmful consequences. So can we start with you, Drew?
Yeah, of course. Thank you very much for that question. I think you raise an excellent point. When we look at the comparable literature on other types of health goods, we do indeed see that, the major concern is for a health good, is this going to keep me healthy? And in the case of water, in particular, you're absolutely right that a month-long period of potentially not full compliance with the product is very unlikely to show any kind of health benefits, especially the perceptible ones in the case of infant and child diarrhea and other sort of gastric illness, more acute in children than adults. I think one thing that this study seems to show is that health isn't the only reason that folks would be interested in consuming a product like this. And we do find indeed positive learning coming out in other aspects of the good. So folks do like the taste of this treated water, by and large, much more than their untreated alternatives. The iron content in the water is very high, and the treatment strips that out. So that's something that folks aren't aware of until they do the taste test and they go through the process. Additionally, the temperature of the water and the delivery convenience, having that bottle come to you every day, be filled every day, and not to introduce a scenario that we've seen fail in many other instances, like the WASH-B trials in Bangladesh and in Kenya. Big problems in those trials were, among other things, folks were having to treat their own water. So the opportunity cost of treatment is extraordinarily high for families. And in this case, we're eliminating that. So folks are finding other aspects of the good that they appreciate. But you're absolutely right that not only is the time period too short for folks to really be feeling any of these health effects, furthermore, open defecation in our sample is extremely high. So even if you had perfect fidelity of clean water use, there are far too many other potential vectors that would deliver pollutions to our participants, fields, flies, fingers, the 5 Fs, right? So, what we were really concerned with in this study was what are all of the possible aspects of the product that people might be concerned with? And indeed, health is one of the major ones, and it's the first one that people think of. But all of these other sort of convenience effects, temperature effects, taste effects, these are things that aren't on people's minds when they think about whether or not to purchase clean water. And we introduce those into the fold, and we actually find that those have a pretty substantial effect on the staying power of purchase. And I think, like, to the larger point of the amount of time here, the next step in this process is to really see if we are to do this with water or with, a similar product, what's the amount of time that one would want to be subsidized in order for that learning to turn into some sort of habit formation? And some, very early literature seems to suggest that somewhere on the order of about 2 to 3 months might be ideal for people to form habits and continue. We're very shy of that in this study, admittedly. Nonetheless, we still see our treatment group consuming at a rate twice as high as the control group. So there is something about this trial period, this subsidy period, that is extremely beneficial for people's learning, but not on the elements that we entirely expect. So I'll stop talking there, but I hope that answers your question.
Thank you. Emily?
Absolutely. Thank you so much for that very insightful question. You get right to the heart of some of the challenges that are inherent in the sanitation space, particularly related to sustainability. So I kind of have a 2-part answer, but I'll go light on the first part because it really closely aligned with what Drew was just speaking on in the kind of multi dimensions of sanitation that we might be able to focus on, right? So yes, health is an important component, yet we do find, we ask respondents in our survey and in other work, what are the benefits that you perceive for different household members of sanitation? And by and large, health is mentioned a third of the time, but privacy is mentioned a third of the time. Safety is mentioned a third of the time, right? And so there are these other dimensions that people are really interested in, and maybe more interested in for female household members, children in the household. And so thinking through those pieces can be really important on the sustainability front. The second thing to mention is that our ERISA sample, while I didn't mention this in the presentation because I was focused on the 2019 and 2020 data that we have, our ERISA sample is actually a long-standing trial that started in 2005. And we've been following these households since 2005. There was a randomized control trial for latrine promotion that took place in 2006. These households were revisited in 2010 and 2016, and now again in 2019. And so we do have some insights from ERISA as to the long-term sustainability. And there's a lot of work out there on this ERISA sample that shows a couple of really important things. One finding from some of my colleagues is that there is indeed disadoption of latrines over this period, as well as readoption. And we're actually working on this readoption question, right? What is driving households to either readopt if there's a technological failure or a need to rebuild, right? Over 2 decades, there might easily be a need to rebuild, and what might be leading to households just disadopting and not readopting, right? And so some of those questions are out there, and I think we can provide some insight in the 14 to 15 years of data that we have from ERISA. The second thing to note that we've really been finding is that there's substantial evidence of peer and social effects, right? So we know that sanitation is kind of a peer social norms related behavior, particularly in some parts of rural India. And so we see some of these and are measuring some of these large peer effects, both in terms of positive spillovers and negative spillovers, right? If you're in a village or part of a village where there's lots of latrine adoption and use, we're seeing higher levels and kind of a continuation of that behavior. Whereas if people are experiencing, are living in an area where there's a lot of disadoption or continued open defecation, there might be some of those negative spillovers as well in terms of social effects. And so measuring both of these things is really critical. And again, IGC gave us the opportunity to not look only in Bihar, but to continue on with this ERISA sample as well to provide some insight into the sustainability aspects too.
Thank you. Sharmishta?
Yes, you are absolutely correct, Dr. Sain, on that. It's a problem where we are just taking the site out of the city and putting it somewhere, and it is happening. And this was actually not a part of our research before to study Ramchak Baria also, but after all these talk about where the landfill is and people don't know where the waste is going, so we thought, okay, let's go and check Ramchak Baria also. It was very difficult to reach there because it was 15 kilometer. It was the traffic on that road was not very good. And when we reached there, we saw the real problem. It is the growing mammoth of this waste, which was actually in the side of this village, but now it is a part of that village. And we talked to a lot of villagers. They are talking about health hazards, how families are not able to go to schools. Kids are not able to go to school in the rain season because the waste is flowing on their street. We talked to one lady where there is some kind of problem is going on with her husband, and the bill of medical bill is over 60,000, and no one is ready to pay. BMC is not responsible for them because it's a different village. There is no way who can cover anything about that. Then we talked to some farmers, and it was not an unfertile land. Ramchak Baria was one of the fertile land, and there were crops before. But with this landfill, now it is the land is getting contaminated, and more people are selling their land and going away from there. And that has changed the social and cultural value of that place. Also, the community structure have changed. Before, it was a mixed income and demography, but now it's predominantly by the domes, who are the waste collector, the marginalized community, and they are the people who are staying there, and they are getting job. It's not like they're not getting job, but at the cost of a big health hazard. There are open fires, there are medical waste. Now there is actually an industry there. We talked to that industry also, who are segregating the medical waste there. So bits and parts, there are things going on, and government is working, health ministry is working on. But what I found when I was doing my study in Patna, that we need more coordination between the departments. Health department don't know what municipality is doing. Municipality don't know what the housing department is doing. So that was the disconnect which we saw, which was the major problem. And I hope that answered my question. But it was a big issue in Ramjagbari, and I actually put that in the blog, but it was so difficult to get in the village at that time. So thankfully it was not raining, and we were able to walk through some of these streets, and we did take some pictures, and it was horrendous. So
thank you very much. I thank all the panelists, and I thank the audience who have loyally stayed with us till the end. This brings us to the conclusion of this session, and we'll be going into the next session shortly, and I'll hand it over to Dr. Ashmita Gupta, who will be moderating the next session. Ashmita, over to you.